Hello, a couple things. I did get microneedling done on my face, so you probably didn't recognize me when you first saw me because I look 25. No, just kidding. But what I want to share today is brief. I've had maybe 3 nurses, which is a lot, come up to me about apparently a trending TikTok video regarding dilution of meds, and I've not seen it, so I'm not pointing fingers or anything, but rumored the video says any dilution of any medication is automatically a med variance. And so I just want to share kind of my thoughts on that. First of all, blanket statements are risky and rarely correct. So that sounds like a blanket statement that is sometimes correct and other times not. So that's kind of first of all. And then my second thought is anytime anything comes from pharmacy, so if it comes from pharmacy in a syringe or in a bag or however else it might come from pharmacy, a vial, it has likely come to you from pharmacy in a formulation that's appropriate to just push. We do consider those kinds of things, and I'm just speaking about my pharmacy, but in general, you know, if a Rocephin dose comes down for a pediatric patient and it's already drawn up into a compounded syringe, that goes directly on your syringe pump. There's no reason to further dilute those kinds of things. Beyond that, my feelings on dilution of things out of the Omnicell, like if you're pulling a ketamine vial directly out or whatever, I have a much bigger concern about us trying to push really small volumes at an appropriate, IV push time than I do about us diluting it. So by that I mean, if you're giving 50 milligrams per ml of Benadryl and it says give this over 3 minutes, it's tough to give 1 ml over 3 minutes. And so I have a much bigger concern from a med variance and med safety standpoint of giving that medication too quickly than I do for you pulling it up into 5 or 10 mLs of normal saline in a flush so that you can appropriately administer that medication over, a slower time frame. The other big one that I'm thinking of off the top of my head is ketamine. It's tough to push ketamine over 5 minutes if it's only 0.5 mLs. So based on the formulation that you have in your Omnicell, you would absolutely need to dilute things like that. Magnesium has to be diluted, has to be given slow. There's several drugs, and I think erring on the side of caution as far as pushing meds a little bit too slowly, aside from, certain things like adenosine, for example, putting them into a flush so that you can push it at an appropriate time seems way safer to me than the idea of saying all dilutions are med errors. The other thing I'll say is that some meds have to be diluted. If you try to give IV lorazepam out of the refrigerator, for example, it's like a gel. It's like giving a solid. So it has to be diluted 1-to-1. Phosphenotoin has to be diluted 1-to-1. Obviously things that are powders should have dilution instructions. And so I guess my thoughts on that statement, again, I haven't seen the video, but the general statement of diluting any meds prior to administration is automatically a med variance seems extremely broad and pretty inappropriate. And in fact, I dilute a lot of things, like I said, just so that I can give it at an appropriate IV push time of 3 to 5 minutes. So those are kind of my thoughts on that. I don't know if that addresses the questions that people have had, or like I said, the kind of viral video that's out there for nurse education. Let me know if not.